Women have to take Truvada every day for it to work. And we know that taking medication every day, especially when you're not sick, is pretty tough for most people. These monthly or bi-monthly shots combine cabotegravir with another ARV medication, and they have the potential to take HIV treatment down from 365 doses a year to just 6. It's another reason to be hopeful about the future of HIV prevention and treatment.
It's time for Spot the Similarity. Health journalist and editor Laura Lopez Gonzalez was in that report, and here she joins us from Johannesburg. Thank you so much for coming onto the programme, Laura. How big a problem is HIV/AIDS in South Africa specifically?
Yeah, I mean, it's a huge problem. So our general prevalence rate is 1 in 10 South Africans are living with HIV. And we know that it's really hitting young women the hardest. So about 25% of our new infections are among young women between 15 and 24.
Across a lot of the world, or some of the world, I suppose I should say, having HIV is not the death sentence it used to be, certainly a couple of decades, 30 years ago. What about in South Africa?
I think for sure you're right. I mean, HIV is no longer the death sentence that it once was. People are living longer, long, healthy lives, having children. The thing is that it's still difficult for a lot of people to take a tablet every day. So that's why injectable treatment, which uses one of the drugs that was used in the trial that you just heard about, and is available in a small number of countries, is really something that I think is going to be a game changer for us. I think equally so is, these injections that can be in the market. We're looking at like another couple of years to really help protect people from contracting the virus. It's not a death sentence, but it's also not the easiest thing to live with.
So what about meeting the cost of getting this injection? Is that down to the patient, or is it going to be paid for by the government?
This is a big question. So you will have heard about the HIV prevention pill, which for women is something that they have to take every day. Cost has been a big preventative factor for getting the HIV prevention pill into South Africa. So we haven't been able to start as many people as we wanted to on the drug. And the real question around these new injections is how much they're going to cost. Viv Healthcare, which makes the injections, has committed publicly to making them affordable, but still big question marks about how much the actual injection will cost, because that cost will be passed on to government, which subsidizes treatment for people in the public sector.
Laura, you'll be able to confirm this for me. I'm pretty sure I'm correct that Jacob Zuma, former president of South Africa, once said that if he had a shower after having sex, he wouldn't get HIV. I mean, what about social awareness of this disease in South Africa? Are people completely understanding what it is, how it's transmitted, and how it might kill them?
So I think, unfortunately, I can confirm that that's something that our former president said. And it was sort of a low point, I think, with HIV messaging. I think most people know what HIV is. We have seen surprisingly decreases in knowledge about how the virus works in recent years. But I definitely think that the stigma around HIV is still a big concern for South Africa. And no matter how much we raise awareness of how you can get HIV, those stigma levels, we know from indexes undertaken in the country before, remain relatively high. So definitely something that is an issue, and that prevents people from going out and getting tested, and then obviously starting on treatment.
And in such a large country like the one you're talking to us from, is the government, do you think, happy with where it is in terms of healthcare in rural areas compared to, of course, in the big cities? Things are often very different compared to people who don't have the same level of infrastructure or support.
Yeah, I think that's a really good question. Certainly, our rural areas are less well served in most cases when it comes to healthcare, but also we have sort of long-standing issues with the quality of public healthcare in South Africa in many ways, especially in large urban centers like Johannesburg, where I'm reporting to you from now. So definitely something that the country is trying to deal with, especially as it sort of tries to approach this idea of universal healthcare and a national health insurance for everyone.
Laura, thank you so much for coming on to the programme. Laura Lopez Gonzalez with news of an injection which could well make a huge difference to HIV sufferers, or patients, we should call them, in South Africa.